Hello everyone, and today I will be discussing memory-based questions in the NEET PG 2023. So, first question: investigation to confirm HSV meningitis. So, what will we do? CSF PCR is the choice for choice of investigation to confirm HSV meningitis. Now, another question: child came with sensory hearing loss and with bilateral cataract and PDA. So associated with which of the virus? So rubella virus is associated with all these of the conditions. Now coplic spots are seen in oral cavity. So which of the virus, which of the disease involved? So measles we see coplic spots in the oral cavity. Now, how to diagnose rotavirus? So there were many options like antigen detection in serum, in blood, in stool, but the answer is antigen detection in stool, and it is not in blood, not in serum. So it is stool. Now, infant with hepatosplenomegaly, thrombocytopenia, and periventricular calcification. What is the diagnosis? Now, it is more seen in association with the CMV, cytomegalovirus, rather than toxoplasma. Both have calcifications, but toxoplasma is rare, and calcification is more common in CMV. So, answer is associated with cytomegalovirus. Now, girl having primary amenorrhea with cyclic pain and on PR revealing that bulge till a lower end of the vagina. So, if nothing is mentioned about that, so the most common thing is imperforate hymen, not the vaginal septum. Now the other question: 23-year-old couple having unprotected intercourse since 6 months. What will be the advice? Reassure and follow up for 6 months, or husband semen analysis or hysteroscopy. What will you do? So the correct answer for this is reassure and follow up for 6 months. Now disadvantages of laparoscopic hysterectomy over TAH. So what is this? More blood loss, post-op complications, more time to heal, or delayed identification of electrocautery burns. So I think this is the best answer out of these options. Now 17-year-old phenotypic girl with primary amenorrhea, breast absent, uterus absent, weight is 48 kgs, height is 155 centimeter, and palpable inguinal mass. So what can be the cause? So it is not due to Turner's. I think it is complete androgen insensitivity. This is the answer. Now this image was given, the ultrasound picture, along with the patient's complaint of pain abdomen and on HMG. Patient is on HMG. So diagnosis is, this is a typical picture of OHSS, that ovarian hyperstimulatory syndrome. Now pregnant female with delivered healthy twins few years back. So what will be the GPAL score? So twins are counted as 1 and not as 2. So it will not be gravida 3. It will be G2 P1 L2 A0. Now uterus more than POG, period of gestation, tense but not tender, and fetal parts hard to palpate, and fetal movements are normal. So what can be the condition? It can polyhydramnios is the best answer, not macrosomia or maternal ascites. Primey delivered a full-term male baby by vaginal delivery. She is known case of bronchial asthma. After delivery, it bleeds profusely, and uterus is atonic. So, which of the following will not be used to stop bleeding? So, carboprost, oxytocin, and misoprost. These are the options. Carboprost, we will not be using the carboprost because it is contraindicated in bronchial asthma. Now patient in baby in transverse lie, age is 36 weeks and 6 days. A patient is stable. What will be the next step? So not conservative, it will be a ECV, external cephalic version. This is the next step. Now pregnant patient on lying supine has faintness. So what can be the cause? Due to compression of the IVC sometimes. So supine hypotension syndrome is the answer for this. Now cervical cancer spread to parametrium. So what is the treatment? Now when it is spreading to parametrium, that means it is stage 2B. So the treatment or management for this is chemoradiation. Now ectopic pregnancy patient, stable patient with 3 mm sac and 2000 is the HCG count. What will be the management? Now oral methotrexate, single dose methotrexate or multiple dose methotrexate. So best answer is single dose methotrexate. Now multiple patient with multiple sexual partners, painful swelling in the vulva and difficulty in walking. This image was given, a live image was given, I have mentioned this. So this is the most common Bartholin abscess. It is the answer. Now partogram based question. Moulting is 2 plus present with the MSL. So what will be the treatment? So LSCS will be done because it is due to obstructive labor, like molting 2 plus, and it indicates obstructed labor. So LSCS will be the answer, not we will be doing low force of vacuum. So thank you for staying tuned, and I will be sharing more questions. So stay tuned, and soon I will be sharing more questions.